Hello and welcome to Lesson 3. This is on telehealth and having a backup plan for a telehealth platform. So you're getting going and you want to start seeing patients virtually. It's best to have a checklist, make sure you're doing it in compliance with regulations and rules. I derived this list here from insurance companies and what they suggest. So it's best to first make sure that you're using a HIPAA compliant telehealth platform. And if it is HIPAA compliant, you should have a signed BAA in place, Business Associates Agreement. I talk about that in other lessons. You want to make sure that you've also completed any telehealth attestation needed for your payer. I know United Healthcare has one. Some others might have one as well. You want to have looked up all the applicable laws and statutes, regulations that are pertinent to the delivery of telemental health, what it means to establish a clinician-patient relationship, whether or not you can prescribe, what are any coding requirements per the insurance company, what are the protocols needed in terms of informed consent and obtaining emergency contact information. You want to also make sure that you have a soundproof room to be in compliance with HIPAA to protect the patient's privacy. You want to use a secure Wi-Fi connection. If you're traveling and you're on a unencrypted Wi-Fi connection, you want to make sure that you use a secure VPN. Have a contingency plan in place for a backup platform. Usually not because the platform will be down, but because a patient may not be able to download an app, for example, or they might not just be getting it to work. I've had people say they couldn't get Zoom to work. Let's try something else. So I know for my states that I service, I need to see the patient visually in order for that to be a virtual visit. So it's not enough to just do it over the phone. I need to have a backup plan in place where I can see them on Google Meet, which is HIPAA compliant because I have BAA with Google Workspace, or on the 8x8 Work app, which I also have a BAA with. Have your business phone readily available to call the patient if there's any issues. Our policies state that the clinicians should call after 2 minutes because most likely after 2 minutes they either forgot or they're having issues. So you want to make sure right off the bat you can take care of those issues and still have pretty much the full session available to you both. You also want to be licensed in the state the patient's in. So if they're traveling, if you notice that they're in a hotel room, you want to make sure that you have a license in that state. For the initial appointment, we came up with not a script of sorts, but guidelines as to what to remind that patient about in terms of your policies. I think this is good practice to keep a standard welcome and standard spiel because you don't want to worry later on, hey, maybe I didn't tell the patient about our prescribing policies, that they need to reach out to us directly. So we welcome them to the practice, thank them for completing the intake forms. We confirm their location, make sure that they have a comfortable and private location. I invite them to take a break if necessary to get any water. This is maybe more pertinent to mental health treatment. I inquire about pronouns and nickname, if applicable. Then I ask the patient to make sure they created a Charm account. If your EHR didn't already mandate or force them to making an account in order to schedule, then ask them to do that because that's how we communicate with patients. That's how we message them. If the patients can typically hear typing, or if you're not good at multitasking, I would mention that you're going to be taking notes throughout the session and also encourage the patient to take their own notes, write down questions for the next session. If you're a prescriber, always remind them to reach out directly. We don't get the electronic requests from the pharmacy. Plus, we want to hear directly from patients. There's a few reasons for that. Sometimes the pharmacy initiates a refill and they don't even need a refill, or it's the wrong dosage, or it's outdated. So we always just want to hear directly from patients. Plus, we get maybe 50 to 100 refill requests a day, and it's nice to, make sure that we're not wasting our time going through extraneous refill requests that the patient doesn't even need, or if they're not even seen recently in our practice. We always ask that all clinicians create a follow-up appointment before ending the session. Patients don't typically create one afterwards. I mean, it's less likely. So don't rely on the patient to create one afterwards. Ask them if you have addressed all of their concerns and if they completely understand the treatment plan. That's always good practice to make sure that they understand everything that you talked about. There's some data that suggests that people often hear a very small percentage of what you actually discussed. Hence, taking notes and making sure that you summarize the treatment plan to them and ask them if they have any clarifying questions, because people, myself included, notorious to not pick up everything during the session. And that's it for this lesson. Hopefully that's helpful. Thanks a lot.